CFO and Director of Business Operation. Okay, we are live and in color. So I just want to welcome you to our application for funding for 2027 Bidders Conference. I'm really excited about 2027. We are feeling really optimistic about our budget and just partnering with all of you again for our recurring providers. We're looking forward to just working alongside of you. There are some new faces here, and we're excited about getting to know you and just letting you know that we're here for you, that we really want to support the work that you're doing, and we just hope that we can just provide information that is useful for you today. A couple of things. We, of course, have our Zoom link. So the people that are on Zoom, I would ask that you would hold your questions and put them in the chat. And the people that are in here, if you could hold your questions to the end, we will get to a questions and answer session where we can address those concerns. Now, the purpose of today is not to go line by line through that application for funding process. It's to really give you an overview of what we're looking for and to call out some of those things that have changed, because there are some changes this year. Now, as always, sometimes it feels a little burdensome, some of the requirements that we are asking of you. But that is just because we are really interested in delivering programs that are high quality to our clientele. They deserve that, right? So when you're going through some of these challenges of coming up to all of the standards, we are here to support you. Something else that is new to this year is we're adding additional technical assistance because we want to make sure that you all have everything you need for program delivery, okay? Okay, so now the PowerPoint's up, so I'm gonna go ahead and get back to my script. So for our agenda today, I'm just going to welcome you as I already have, and then we're going to cover funding. We'll talk about our ADAMHS funding from next year, our availability of funding, and our minimum funding requirements. We'll also bring the directors up to talk about what's new with treatment and supportive services, what's new with prevention and early intervention, and then what's new with fiscal. We will then go into detail about the technical assistance that we will be providing, and we will allow a question and answer session, and then we'll have closing remarks. My goal is to get all of you out of here on time at 11 a.m. so that we can just be respectful of everybody's time. So the purpose of the application for funding is for the delivery of prevention, early intervention, treatment, and supportive services to occur during the calendar year 2027 fiscal period. That is January through December. I want to call your attention to some of the resources that we have. So last week, we released our calendar year 2027 request for application. This document is really your Bible to help you navigate the application process. It's about 66 pages, and we really took the time to just guide you on what our expectations are and what we're looking for in each section. Please use this as a resource. If you use this as a resource, you will submit high quality applications. I am going to pause for the cause, and I'm going to shout out our wonderful grant coordinator in our back. She's looking like, please no, Nadia. So Nadia, will you please raise your hand? I won't make you stand. She's in the back there. She has worked tirelessly with myself and with the team to make sure that this document is useful for you all, okay? So please take your time and go through this. On page 6 and 7 of this guide, you will find a resource list. The resource list will point you to everything you need to fulfill your application, whether it's the budget templates, whether it's knowing the assurances and expectations. If you do receive funding, those resources are listed on page 6 and 7. In addition to this 66-page document, there are 2 dedicated guides for prevention and early intervention and treatment and supportive services. Those 2 programs have very distinct guidelines for the application. If you are providing those services, you can go straight to those documents to help you. And I would implore you to do that, especially because prevention has 7 applications. Don't get overwhelmed. We'll get into it. So our estimated budget for 2027 is about $37 million. Most of our funding comes from the Human Service Levy. So I thank you for all who passed that Human Service Levy, because most of that funding is coming from that to provide these services. 38% of that comes from state, with the majority of that 38% coming from the Ohio Department of Behavioral Health by way of allocations. Allocations are a significant funding tool that allows us to braid funding with levy to support the programs that you all are applying for. 3% comes from the grants that we apply for. So we do, as I mentioned, we have a grant coordinator in the back who is researching all types of grants to make sure that we have funding to pass along to you all. What I will say about this $37 million budget, 86% of all that we receive is going back to you all. It's going back to the services that we fund. I need to mention that our funding depends on available resources. The previous slide was an estimate. We still have to wait on those appropriations from the Human Service Levy. So the funding that you receive is really dependent on our availability of those resources, your performance, and quality standards, okay? It's never guaranteed, and you should be thinking about sustainability plans. One of the ways we're asking you to think about sustainability is we implemented a match program that many of you are familiar with. This is for sustainability because should anything happen to our funding and there be a significant decrease on our end, we want to make sure that you have been aligned with other resources to ensure that those programs are still available to the people who need them. New this year, we are interested in hearing from new providers. We, of course, will fund current providers, but we're looking for current and new who offer innovative, creative solutions for the current county needs, okay? So typically in our bidders conference, we go through a huge list of all the eligibility and organizational requirements. One of the new things this year is through our EC Impact portal, we have a pre-screening process that every provider must go through, whether you're a new provider or you're a provider that has already been receiving funding. The purpose of this pre-screen will address every question and allow you to acknowledge if you are eligible for McAdams funding. As a government entity and as an ADAMHS board, unfortunately, we can't just fund anybody's idea. There are standards that we must hold our providers to, and this pre-screen process will allow you to know if you are eligible for our funding, okay? As part of the pre-screen, it will outline some of the required documents that we need you to submit. For an example, we need you to submit your audit, okay? Previously, if you have been funded, we had a compliance section that was new last year. We got rid of it because a lot of you did not know it was there, did not know to put your information there. So we have went back to asking you all to upload those compliance documents through the supporting documentation area. So now I'm going to pass it on to Kimberly Priester, our Director of Treatment and Supportive Services.
Okay, so this is for the Zoom people. Can you give like a thumbs up, Zoomies, if you can hear me? I can't see it, but Colleen, can they hear me? Okay, yay. Good morning, everybody. We're so glad that you're here, like Chrissy said. I'm going to talk about just a couple things so that we can stay on track with the agenda that we have today. So my name's Kimberly. I am the Director of Treatment and Supportive Services. And I want to talk with you about just some priority service gaps that we have identified through several different stakeholder meetings in our community. As some of you know, we are always working on mapping in our community. That might be through adult sequential intercept mapping, where we're identifying those different needs that we have. We also have done the juvenile mapping. And so we also then continue to have these meetings with the providers and different stakeholders in our community, because our goal is to be able to be aware of where some of those needs truly are. We get great feedback from the community. And so with that being said, one of the areas that we truly, I'm asking somebody in this room, somebody on the call, anybody on Zoom, we need some additional support with reentry assessment care and coordination. We have a CTP, which is a community transition program that is supposed to link people from the prison straight into treatment. What we have identified by working with the Office of Reentry is that there are individuals that are not leaving prison and being connected through CTP. So we would like to place a clinician to be able to work with the Office of Reentry. So we had released an expression of interest for that. We did not receive any interest. And so now I'm coming to you at our bidders conference saying this is something that there's a real need in the community. The other thing that I have also noticed and have been tracking is alcohol use disorder medication support. So let me talk about this just for a second here. When the pandemic started, and I know probably haven't heard that in a hot minute, the pandemic, but people started drinking more, right? They just did. You know, we would do wine with DeWine. I mean, I didn't. I was at work, so I wasn't whining with DeWine, okay? But there was wine with DeWine. Like, there was just, I think, naturally a lot of us, you know, just to kind of cope, we're just, well, let's have a glass of wine. Let's just hang out. What I actually found, and I think what through some data and stats have shown, is that it's actually created an increase in alcohol use in communities across the country. And specifically in our area, we have noticed an uptick in alcohol use with adults, with teens. And so there's a lot of stigma around that. So we already know there's a lot of stigma around substance use and trying to get treatment for that. There's also a lot of stigma with using medication for alcohol use disorder. And I really want to hear from you all. Do you have doctors that work for you that are willing to prescribe medication to help support someone as they're trying to titrate off of alcohol? What programming do you have for that? What creative ideas do you have so that we can help destigmatize this and start the conversation? We hear a lot about Narcan and opioid use, and we have our whole anti-stigma campaign. Thank you, Colleen. But what about the alcohol stuff, guys? What about that? Are we going to let's start talking about that. I'd love to hear some of your ideas. And I would love to know which providers have doctors that are willing to prescribe. So this is something that I really would like to, hopefully as a community, start to target that. Crisis services capacity, ongoing, always ongoing. We want to be able to offer support 24/7. What that means is we're looking for innovative and creative ideas, potentially hybrid ideas. What are some things that we can do to ensure that we have coverage 24/7? And I'm going to leave it at that. And I just want your creative juices to flow. Please keep in mind that we always have 988, and that is who you call when there's a crisis. So one of the other things, you're going to see a theme here. Well, there's a theme here: prenatal and postnatal, family support, and transition age. Tristan and I have been working together a lot on how do we move through the continuum of services from prevention, early intervention to treatment. And you can't have those conversations without talking about family, without talking about the need for education in the home, with the family's support. I want to hear creative ideas about how do we support women while they're pregnant? How do we support families through the pregnancy? How do we support the families after the kids are born? Like, this is such a huge opportunity for us to really engage with our community and the families. We can make such a huge difference if we're doing the education here on the front end. And then what are the treatment options that we can offer on the back end? But we have to look at the full continuum before we're ever truly going to make the impact that I think we need to make. So get creative with all of this. And I know some of you are aware we do have some maternal health initiatives already that are going on. So, and you guys are a room full of people that are highly creative and innovative. Montgomery County is known for that. So I can't wait to see what some of these proposals are like. High acuity, this is a shout out, I gotta bring this one up. We have individuals in our community that nobody wants to work with. Nobody wants to work with them. They're stinkers. You know, we know that. We call them our familiar faces. We really need to have some additional providers step up and be willing to work with individuals that are transitioning from Summit. I'll just say it like that. One of the other things I'm going to say is if you hear any topic that I'm discussing today and you want more information, reach out to me and we can talk about it separately, because I'm giving you just a glimpse of some of these priority areas. I don't have time to go into like the weeds with it. So if you're like, oh, Kimberly mentioned high acuity treatment and support, I'm interested to hear more, reach out to me. Another big pain point is the transition age youth. They're falling through the gaps. We've got lots of wonderful people that are working and trying to help support this. I really would love to see if we could get some proposals that identify that they could have some youth navigators to stand in the gap. You're going to see a theme here. Who's going to stand in the gap? Who's the person that's standing there saying, I'm going to help when nobody else will? This is the group of people that is struggling, and this is where we need help. 18 to 21. Yes, we have MRSS. Please call 988. They will connect you to choices. There is that level of support. But what we're still struggling with is a system that isn't always fully communicating. So I need you all to get creative and say, how can we stand in the gap with these kids that are 18 to 21 and pull together? I would love to have some navigators, transitional age navigators. School-based supports, Tristan has done a phenomenal job, and I don't need to give her kudos, but I like to give her kudos. So of mapping all of the things that are happening in the schools. So one of the things that she noticed and then brought to my attention was that there's really a lot of gaps still in the school. I think we're doing a really good job of trying to come together and plug in different therapists or case managers or student resiliency coordinators. But if you really look at the data, and please, I'm sorry, Tristan, don't kill me for this, ask Tristan for the data. It's crazy. You will look at these results, and some schools don't even have nurses. Some schools have no therapists. They've got, I mean, it's mine. It blew my mind. And so with that being said, if you have the ability to do a proposal and are open to talking through where maybe some of those needs are, we would love to hear your proposals. I get excited, so I have to drink water. Oh my Lord, don't kill me for this one. Okay, this down here. Programs that have access to our Medicaid cost center. That means if all you ever do is enroll individuals in GOSH, which GOSH is basically just like our billing system for people that don't have insurance. And I'll just keep it really simple like that. I'm sure I'm not explaining it perfect, but if somebody doesn't have insurance or they have lower income, they can use GOSH. We have some providers, or if you are a new provider that is wanting access to this pool of money, you have to do a full application. And in that application, you have to put outpatient treatment. It could be medical detox, whatever it is, because basically what's happening is you are tapping into those levy dollars for individuals that, like I said, do not maybe have income or don't have insurance. So we have to have a full application. On and off through the past couple of years, we've noticed that sometimes people are putting it in their application, sometimes they're not. But if you are finding that you need access to those resources, you need to apply, you need to put in your program name. We will no longer be offering access to the Medicaid cost center unless you have done the entire application, even if that's the only thing that you're applying for. So that talks about Medicaid codes. So that cost center here, those are all the same CPT or HCPCS codes that you would use if you were billing for any service under ODM, Ohio Department of Medicaid, their behavioral health manual, their guidebook. So when you go in and you apply for a program, you are going to estimate, I think I'm going to do 300 counseling sessions that may need to be supported by this cost center. You're going to use the 90832, 34, 37 cost centers. We will go into more detail with this during TA sessions. The non-Medicaid type codes are used when you're trying to provide a service that Medicaid doesn't have a code for, right? So we've got a lot of cool, innovative things. An example is the school. I think a lot of times maybe behavioral health providers struggle to maintain in the schools because you're trying to engage so much with families. You can't always open the case to then be able to start billing. So we have created some engagement codes so that your staff can get reimbursed for the work they're doing up to the point of getting that individual the services they need. So the point of the non-Medicaid codes is to be able to do really cool creative ideas where there aren't Medicaid billing codes yet. So once again, just remember, programs that have access to our Medicaid Cost Center and are planning to utilize that, you must apply in the application. Okay, I think I have one. Yes, I have one more slide and then I get to pass it to Tristan. So I have my notes here and I'm just going to read this because I have a couple little pointers. I'm just going to say this. These are my pointers, okay? Appendix A, common applications and pro tips. So in the treatment and supportive services document, Appendix A, list. I went through 2 years worth of applications and all the common errors, and this highlights all of them, okay? So application errors, pro tips. The assurances for treatment and supportive services are in Appendix B, okay? Appendix C is going to show your ACM levels of care. We continually, there seems to be sometimes some inconsistency with program name to what your ACM level of care is. Look at that. It'll help you identify what your ACM levels of care are. Appendix D, you're going to see the workforce development and training requirements. One thing we're doing different this year is you will be given your training requirements at the time that you are given your notice of funding award. So we want to be able to really tailor any training expectations that we have to meet the needs of that program and not make it so cookie cutter. I also want to remind everyone, in the RFA, the main RFA, in Appendix D, there is a calendar year 27 application submission checklist. If you use that checklist and check off every single thing, you should have a pretty good application. Okay, we really tried to do a good job this year of highlighting all those common errors and then saying this is what you need to do. Don't hit submit until you check all those things. If you check all those things and hit submit, you're probably going to be pretty good. So also, and Colleen's going to talk about this later, we do have more technical assistance sessions this year. We want to help support on the front end, so it makes it less painful for everybody on the back end. With that being said, I'm going to pass it to my colleague, Tristan.
Got one. All right, good morning, everybody. Thank you all for being here today. I'm going to provide some high level on prevention and early intervention and what we're really looking for here. So I will say we have 7 applications in prevention and early intervention, and I promise this is for the benefit of all of you. These 7 are all based on the unique needs of different programs. So in the past, we had less applications and we were asking all providers things that may have been irrelevant to their program. So we really tried to tailor what questions everyone actually needs to answer, and you will find these 7 programs. When you go into the portal and you add a program, based on how you answer questions, it will generate what application you will receive. But if you are like me and you want to know the rationale as to how that is all configured, I created a nice flow chart so that you can really see how everything is tracked and what application you will be using. Now, you will also notice that the prevention application guide is a little lengthy. That's because we have 7 application guides in there. So if you are only facilitating infant and early childhood mental health program, you only need the 1 application and you can just disregard the other 6. You do not need them. In each application will walk you through, or each application guide will walk you through each application and really let you know what we're looking at for each one. So when you are going through the application, before I say this, and I know that this has been reiterated time and time again, but the number one thing that I see in terms of new providers coming on and wanting or looking for prevention funding is you have to have an ODBH certification to provide prevention services from your organization. So if you do not have that and you are not an exempted entity, then unfortunately we cannot provide prevention early intervention funding. But moving on, so you will notice within this prevention application guide, there are a few appendices. So Appendix A is our scoring matrix. And so what we tried to do this year for the scoring matrix is let you know exactly where the reviewers are going to look for whatever it is. I think that there was some confusion last year on where some of that was. So if you're like, well, where do I put this in my application? It should say on the bottom where you're going to go. Appendix B, Prevention Early Intervention Assurances document. I will talk about this in the next slide. Appendix C is the evidence-based programs overview. So historically, we've asked you guys so many questions about these evidence-based programs that we already know the answers to. So it seems silly that we were asking you how many sessions there are, how you will be evaluating this curriculum, what is the age group. We already have all of those answers. So you will find them in Appendix C for evidence-based program overview. And then Appendix D is Prevention Early Intervention 2027 current and expected positions. As you go through the application, you will assign people to different things. We know that a lot of our prevention providers' positions can be flexible dependent upon the needs, especially from schools. So we just want a full list of everyone that is on your team and or you expect to hire or could potentially hire. And then we will kind of take it from there to look at the capacity when schools are filling out what programs they're interested in. So this is the assurances document. There are some additions this year. We try to put everything in it. This was formerly known as your Prevention and Early Intervention Guidance document. Before that, it was the Billing and Tracking Guide. It's had a few names. It's gone through a few iterations. But this year for prevention programs, instead of you guys signing an assurances document that is both prevention and treatment, treatment has their own, prevention has their own, so you're only signing off on things that are pertinent to your programs. Please read this document thoroughly as it outlines the calendar year 27 contract expectations. There are several changes. I tried to put them in an exciting blue color to let you know what is new for calendar year 27. Program supervisor requirements and recommended guidance on the number of supervisees for prevention and infant and early childhood mental health are listed in there. There are standardized rates this year for prevention services based on credential. That also tracks for infant and early childhood mental health, but it is a separate table. Once you dig into the document, you'll see what I mean. Providers may opt to budget for less than the standardized rate if they desire. I know that pay scales can be different depending on different organizations, so I understand that. But these rates are the maximum amount that ADAMHS will reimburse for the services at each credential level. Providers are not to exceed this rate within the ADAMHS line item and or the match. So all encompassing, the rate is the rate. And just a reminder, for an OCPS, they can only manage one program or curriculum. OCPCs, CHES, MCHES can supervise, I guess, as many as they would like. And just a few helpful hints, some things I want to call out. The school-based applications, you do not need a budget because the schools are really going to be deciding what services they want. So it doesn't make sense to budget quite yet. But because of that, they are due July 10th. We tried to streamline this application as much as we possibly could. That's why we have that nice chart of all of the programs. We've done all of the work. I've met with so many different curriculum developers over the past couple of months to figure out really what the standards for fidelity are for each curriculum. The school-based providers will be provided with your recommended amount in the fall after the school select the services. If you are providing community-based services or infant early childhood mental health, we do ask that you get MOUs, memorandum of understandings, or letters of intent from each provider or community partner that you will be providing services to or with. I believe that there's only one spot for an upload there. So if you can combine all of them, scan them all together. If that's not possible, reach out to us and we'll provide you with a Dropbox link so that you can do that. If a program is both community-based and school-based, it does require 2 applications. So I apologize for that, but I promise it'll make it way easier on your end and our end as we try to decipher what is what. And then technical assistance, TA sessions for prevention early intervention programs, including infant and early childhood mental health, will be available for one-on-one program consultation from July 6th through July 10th. I myself will try to make as many of those as I possibly can. I will also have staff available for that as well. This is really in response to, we were meeting with so many providers after you submit applications on what needs to be changed or revised, rather than you guys guessing what we want and us telling you on the back end. We're like, why don't we just tell you on the front end? You guys have a great application, and then we have you submit it that way. So hopefully there's not as much back and forth after the applications are submitted. Those are open to everybody applying for prevention early intervention services. So with that, I'm passing back to Chrissy.
Okay, let's talk about some of the fiscal changes and fiscal components. So new this year in fiscal, there is a new budget template. Previously, you all needed to submit a budget narrative that was inside the application. We have done away with the budget narrative because within the template, you will be providing justification for each line item. The budget template is different in that every single activity that you are budgeting has its own page. So it has its own page for personnel and salary. It has its own page for consultants. So we can really understand the details of the expenditures that you're asking for. We want to understand what it actually costs for you all to provide the services to make sure that we are providing the funding that is needed. Last year, some of you may recall that we had a match acknowledgement letter that your executive director and your board chair had to sign as part of the contracting process. We have removed that, and there is a checkbox within the application that will allow you to acknowledge that you are required to have a 25% match for the program that you are proposing for funding. New for 2027, we talk about braided funding. We have the braided funding from the levy, and we have braided funding from state allocations. At your time of application, you do not know if you will have a state allocation that will help to offset your program. But if you do have a state allocation that is helping to fund your service, no match will be applied to that portion of your budget. We're trying to relieve some of the burden from the match because we know that the match has created some burden for some of you, but the match is really intended to make sure that the levy funding is nice and secure and sustainable. Indirect rate. So you all know that the federal indirect rate was increased for 2026, and we didn't increase it. Well, we're increasing it now. So you can ask for up to 15% in your indirect rate. What that means is ADAMHS funds for direct services, the people that are actually delivering services and the activities that are actually applied to get those services out in the community. We do not fund your overhead. We don't fund depreciation. We don't fund your building costs. Those things are considered indirect costs, and you can ask for up to 15% of those expenditures. We do have a conflict of interest portion within our application that you all must adhere to and really go over to make sure that there are no conflicts of interest. And I will get into the O4O categories a little bit more, but I want to give you a snapshot a little bit of what the budget summary looks like. So this is the budget summary page. When you open your template, it's the first page that you will see. Notice right away that there are yellow cells and there's white cells. The yellow cells means I need you to input something. The white cells mean it's a formula and it's pulling from elsewhere. This is an example of one sheet that is dedicated to one activity, which is personnel, salary, and fringe. You will have to fill out a section for every individual that is being covered on your budget. Their name and position, their salary and their wage, even their credentials and licensure, so we can understand why that person is needed for this budget. And you will notice at the bottom that yellow justification box, do not leave that empty. Help us understand why that person needs to be on your budget. 040 categories. Let's talk about this a little bit. So I'm going to read this box up here. So bear with me. Some awarded applicants will utilize state funding, either entirely through braided funding to support the program, and state funding has additional reporting requirements. As I mentioned before, those fundings do not require a match. To accurately determine which programs align with these state funding categories, we're asking you to complete a table within the budget template that allows us to understand where your services fall in the service category. So as an ADAMHS board, we're required to submit an annual report every year showing how we receive funding or how we're funding our different services and how it was allocated and spent. That is called an 040 report, okay? As part of this report, the services that you all are proposing have to fit very nicely into a service category that is on this report. To improve the accuracy, we're asking you all to match the service you're proposing with one of the 45 service categories that is on the 040 report. If you're going through this template and you can't figure out how to match your particular service with the category, we'll have technical assistance to help you get to the right selection. Both Kimberly and Tristan have mentioned agreements and assurances. If you don't know what that is, that really is, if you receive funding, these are all of our expectations. It will behoove you to really understand what we're asking of you, because we do ask a lot from you all. And we really appreciate all the work that you do. This will tell you how to bill. This will tell you all the quarterly, annual expectations that we have for you. There are 3 agreements and assurances. One is with the Ohio Department of Behavioral Health. Because we receive so much of our funding from there, they have their document and their expectations that you must sign off on. And then we have the ADAMHS agreement and insurance, one document for prevention and early intervention, as well as one document for treatment and supportive services, as both Tristan and Kimberly have mentioned. So now let's talk about the application portal itself and get into the technical assistance. So I'm going to call up Vic and Emma. Please introduce yourselves.
Hello, everybody. As Chrissy said, we're going to talk to you a little bit about getting in the portal and how to navigate to get your application started. So my name is Emma Goldinger. I am the Quality Improvement Coordinator for Treatment and Supportive Services.
And I'm Vic Vrabel. I'm a Program Coordinator for the Prevention Early Intervention side. And I'm going to start off talking to you about the EC Impact Portal. It's the same portal we've been using for the past few years. How you get in, put in your username, your password. If you forgot your password, you just go right here, click the link, and it'll take you to the email password reset. If you've never been in the portal before, or if you're new to the agency, click a request to get a new account, or you can reach out to us at support@mcadams.org. Me, Emma, and Alex all have access to that email. So just reach out to it and let us know. And here is the address. Down here, you could barely see it because it's kind of blocked. But if you're not seeing our logo at the top, that means you're in the wrong site. Go here, and if you still can't find it, just email us and let us know.
All right, so once you guys get your agencies in the application, the next step is getting your programs registered. So once you're on that front page of your application, you will see in this info graphic here that you have a spot to create a new program or add a program that maybe the system has history and knows the name of it. So everybody needs to manually add your programs. Each program needs manually added. The process here is that once you add and complete that registration, then we need to approve it on our end. So just, I want to make it known that there might be a lag in the system sometimes. So just be patient with us. Don't email us right after you register it. We'll get it approved pretty quick. With that, there is a deadline to add programs. It's 2 days before the application. It's going to be on July 28th at 5 p.m. This is to ensure that you guys have enough time to fill out your program documentation and all the information. And you're not waiting on us for anything that you might need to approve that program. All right. Then the next step that you guys need to know today is that the application is going live in 2 hours. So once you guys leave here, it will be live at noon. I encourage you guys to all get in the application, play around, and familiarize yourself with the application so that if you have any questions, you guys can bring those up at our TA sessions. All right. And with that, I am going to pass the mic on to Colleen. Thank you, guys.
Thank you. Good morning, everybody. I am your last speaker today, so I'm getting you. I see lots of you taking pictures of this. The PowerPoint will be uploaded on the MC ADAMHS website under funding opportunities, so don't panic. Take your pictures if you'd like, but I'm going to throw a lot of dates at you. I'm here to really tell you about the support that we're going to offer you. We this year have really amped up, I think, the support that we're going to be providing to you all to make sure that you're providing the best application possible and feel really confident going into this application process. So here's some of the virtual technical assistance that we're doing. We'll be providing virtual office hours for fiscal, programmatic, and then portal navigation. So if you need technology help with the EC Impact site. Here are some of the already scheduled virtual TA session dates. You'll notice treatment and supportive services is doing 3 for 3 different topics, all happening throughout the week of Monday, July 6th. So that Monday at 9:30, treatment team will be talking about programming, so any programmatic questions specific to treatment. The next Tuesday, July 7th, also at 9:30, they'll be doing a session on portal assistance to help you navigate EC Impact. Then our finance team on Wednesday, July 8th at 1 o'clock is hosting a session to help you with your budgeting or any fiscal related questions that you have. And then Thursday, July 8th at 9:30, treatment and supportive services will be hosting a session specifically to housing services and our housing providers. All of the links for this will be on our website, mcadams.org, under funding opportunities. That really is your one-stop shop for all of the information that you need. The RFA is there, the additional documentation is there, and then these Zoom links will be there as well. You don't need to register. You can just hop on anytime throughout that hour that you're able to join. In addition to those planned sessions, both prevention and treatment have offered one-on-ones for each of the providers if you would like. Prevention is doing those that week of July 6th, and then treatment will do them probably after that week because they have those planned sessions throughout that week. So after that, they can schedule those as well. So those are available by request. To request for prevention, you can reach out to Tristan. And then for treatment, you can reach out to Kimberly to get those scheduled. That's a great time to ask questions specific to your organization, specific to your application that you need help with. And then again, the Zoom links for all those TA sessions can be found on the website under funding opportunities. Another way that we have to support you is our frequently asked questions. This is similar to the process that we used last year. Outside of your individual TA sessions, the only way to get questions answered about the application process is through our FAQs. The reason for this is that we're making sure that all of you are getting the same information. We're not telling one provider something that we're not telling another. And if you're not thinking of a question, then those FAQs that other people have asked will be available to you as well. So we will maintain a list of those FAQs, again, under funding opportunities on the MC ADAMHS website. You can submit applications to support@mcadams.org. This is the only way that you can submit FAQs. Staff will not be responding individually to FAQs. It has to go through this support email. The last day for that is going to be July 28th at 5 o'clock to be able to get those questions in. We will update the FAQs every Monday, Wednesday, and Friday, starting next Monday through July 29th. So you've got a little over a month of FAQs that we'll be updating for you. So you can continue to go back to that funding opportunity list on mcadams.org and see our most updated FAQ. Something new this year, those of you that filled out our survey to give us feedback on the process, we listened, so thank you for that. We will respond directly via email. It will probably come through the support@mcadams email to you. Last year, we didn't respond directly to you. We just put the answers in the FAQs. We will respond directly so that you don't have to go searching through the FAQ document. Just please remember, we have to all get together. We look at all the FAQs. We come up with the answers. We make sure we're all on the same page, especially for a more difficult question or a new question. It still may take 2 days or so to get back to you. But we will have those answers every Monday, Wednesday, and Friday. Okay. A last reminder of the deadline. So you heard all of these today, but just to put them in one spot for you, we do have at the very end a table that has all of the deadlines up there for you. I know we threw a lot of dates at you. So just remember, our deadline for school-based prevention applications is Friday, July 10th at 5 p.m. The deadline for any FAQs is Tuesday, July 28th at 5 p.m. Deadline for new program requests through EC Impact is going to be Wednesday, July 29th at 5 p.m. And then your final deadline for applications is Friday, July 31st at 5 p.m. Please make sure that you are following these deadlines closely. There are not exceptions to these deadlines. Okay, with that, are we calling the team up for questions? Okay, so with that, I'm going to call the team up for questions. We want to make sure that we're getting to as many questions as we can in our final minutes here. In order to be inclusive of everybody, what we're going to switch off, I think, between questions in the room and then questions on Zoom. So for those of you that are on Zoom, feel free to put your questions into the chat, and we'll read them off to our directors that are up here. But I'll turn it over to Chrissy for our room questions.
Before we do that, I want to mention one thing that is just kind of like the elephant in the room. It's actually Miss Perry's question. We started this process significantly earlier this year. This year, we are aware that some of your contracts got to you a little late. We don't want that to happen again. We want to make sure that we are getting your contracts in your hands so that you can bill right away and not be out of funding before you receive those reimbursements, okay? So we're trying to work alongside you. We're doing all that we can to make sure that we're getting your funding to you. Okay. First question. Anybody? Okay. Yes. So what's your name? Linda is a new organization. She is not started yet, and she doesn't have an audit. I believe one of our requirements is you do have to be in existence for a year. That is an awesome question because you don't have services in the county quite yet. Just to let all of you know, there is an audit waiver process, but we really need to think about the services that you are using for Montgomery County. And because you don't have any of those services, I need to understand that. Okay, so, yeah. Mm-hmm. Good question. I've already been stumped.
So we anticipate that all of the the question was, forgot to do that. The question was if you are providing an evidence-based behavioral health screening for prevention early intervention services, which of the applications would you utilize? So if it's an evidence-based behavioral health screening, then that's problem ID and referral. Our standard is that any screening instruments would be evidence-based. If for whatever reason you were doing a screening that was not evidence-based, then that would fall under that unlisted category. Good question.
Okay, I have, oh, that's loud, hello. I have, I'm going to answer this one.
You can.
There is a deadline for the pre-screen because there is a deadline to add a program, which means with that, there's a deadline to get your agency in the application. So you need to make sure you're doing the pre-screen to get your program in the application. As long as you're doing that all before that Wednesday at noon, you're going to be good to go. Just make sure you're giving yourself enough time to get in the application and to add all of your programs.
Wednesday, July 28th. 29th. 29th.
Chrissy, can the match be in kind?
Yes, it can. And there is a match guide that will actually walk you through that in kind piece. Yes. Ms. Perry? Yes, you do. So that Ms. Perry asked about the request for application document. That is the Bible that I referred to earlier. That is posted on our website, mcadams.org, under funding opportunities. It is labeled CY27 requests for applications. That is right on our website.
Another one from Zoom. Will we be applying for typical SOS funding for RH and peer support through the AFF? Also, are there dollars for the new Medicaid changes that may impact? Will we be applying
For calendar year 27, I would like for you to put in the application any program that you need funding for. So because SOS and some federal dollars are not always known as to what's going to happen, the preference would be that if you have programs that need funding, please put that in your calendar year 27 application.
Yeah. So actually the team and I discussed this yesterday. Because those dollars from SOS are so significant, when you're applying for those funding, the SOS budget needs to be labeled SOS recovery housing. And that will help us understand which portion you're asking for to go in the SOS dollars.
And then the second piece of that is, are there dollars?
I think right now what we're doing, and then I'm going to pass it to Chrissy because she's our interim CEO and our CFO. We are currently monitoring and following up with providers to see that impact. So I think we need to see the impact and be able to have dollars connected to that to be able to identify what the need is. And then I'm going to pass it to Chrissy.
Okay, that's a great question. Currently, how we're funding those services through our Medicaid type allocation, which is a first come, first serve pot. It is a healthy allocation and it is a healthy pot. But what we need from you to ensure that we have the dollars there to support you is to go through the application process for the Medicaid type dollars that Kimberly mentioned earlier. Previously, providers did not have to submit an application. You could just pretty much come and get the money and sign an MOU. This year, we need you to estimate those dollars that you think you need from that allocation so that we are budgeting appropriately to really meet that need.
About how long will it take to create a new account?
Should take you about 5 minutes. As long as you have your info, if you need to go find your info, it might take you longer. But if you have all your info, your address, your email address, make a password, it should take you about 5 minutes. It can lag in the system for us to approve it. So give us like 24 hours, but it shouldn't. We're going to be monitoring it closely. So, yep.
We have time for a couple more.
Yeah, we didn't put that in there, but essentially get them in as soon as you can. Just know that there could be a 2-day lag time in terms of getting your programs approved. So I don't want you guys putting it in on Friday and us just not being able to get to it, or the system not giving it to us. So please, if you're doing school-based prevention programs, plan to get those in by Wednesday, July 8th. Is that a day? Wednesday, whatever the Wednesday is before the 10th. Yes, that would be July 8th. Yeah, good question. Oh, yeah.
Speaking of July 8th, there is only one July 8th, and that's Wednesday. So this Thursday date is actually July 9th. So we'll get that corrected before we post it. We have time for a couple more. And we have discussed this. The services are for Montgomery County residents, okay? And they actually need to be in the county. But we know sometimes that individuals that are Montgomery County residents may need to go outside of the county to receive those services. But the services are for county residents because our tax dollars are for county residents. Yes. and on the treatment, so for the people that are online, the question is about the county reach and if the services are for, who are the services for, and where should the services be provided for. On the treatment side, we use our GOSH system, which requires an enrollment process that part of that enrollment process is to understand their location, their physical location, to ensure that they are residents of Montgomery County. This is for a prevention and early intervention individual, correct? You would have to understand their residents. I know that is a nuance, but that is something that is happening because our tax dollars cannot support residents that are not here in Montgomery County. And for the people that are online, if you are serving individuals who are from different counties, we're encouraging that you reach out to that county's ADAMHS board for funding. And that does happen from time to time. Yes. Yes, but there's some exceptions. So yes.
Tristan said there's no exceptions for prevention. They don't have to have national accreditation for prevention. For treatment and supportive services, yes, typically you do, but there are some exceptions. Please read the RFA. All of the pre-screen, the RFA. I want to sing and dance. Read the RFA. Okay, I don't have good rhythm, but I need you to just read the RFA. It's all in there. I promise.
Go through that pre-screen process. It'll tell you all those exceptions. Yes. Are they working in Montgomery County or? And I think we're getting more of that. So the question is, can we have providers that are outside of the county? I would presume that your office is not within the county, but you're serving Montgomery County residents. That is totally fine.
Great question. I was going to look at historical spending and really understand what the applications are. I don't have an answer for that, but good question.
What is the option?
Schools must have opted in. That happened this week. I think we have all but one public district that has opted in, and I am working on that public district to make sure that they do opt in. And yes, the schools for school-based services, the schools are to select that. I will not be accepting MOUs from providers for school-based services. Yes. So the way that we're doing pre and post tests has changed. Anything in blue that says new for calendar year 27, please take notice. We have also put together some supervisor guideline recommendations in terms of how many people based on credential you can supervise, just because a survey that we did last year said that staff did not feel supported in getting higher levels of credentials. So we want to make sure that staff do feel supported. We also understand the reality of how many people that we have that have those independent level credentials here in Montgomery County. So I will say we can talk about that a little more in a TA session for each provider. Whether or not an individual has a diagnosis.
Not for prevention and early intervention. Oh, for treatment. It depends on the program for sure. Federal. Can you repeat the question? I'm thinking they're talking about their driver's license. Well, Kimberly, they do have to have a social security number, and gosh, we're not photocopying any of that, but we do ask them for their social security number. And we have a way of making sure that that is accurate, but we're not asking them to present us with anything. Yeah.
That's a loaded question. This really ties down to what each provider wants to do in their organization and how they want to handle that. I can speak to our lens and what we need. What Chrissy just said is, in our system, we need a social security number in order to be able to move forward with payment of those services. The only exceptions to that sometimes happen with population-based services, which most of you, that doesn't even apply to the programs that you're proposing. I'd be happy to take it offline and have a conversation in a TA session, but we need a social security number to process payment, and gosh.
And then I have one more that asks,
All right, I do real quick have one more thing in case this causes any confusion. I just want to, an important deadlines, it says deadline to submit school-based prevention applications. That's actually school-based prevention and early intervention applications. So anything that will be school-based that you are applying for through the prevention early intervention division, we typically just call it prevention because I guess we don't spend all of the time saying and early intervention. Know that that's one. So any of those school-based services, regardless of if it's prevention or early intervention, do need to be submitted by July 10th.
Okay, I think we're a little bit over, but not too much. I hope you all are feeling really optimistic about your application and for calendar year 2027. I want to thank all of you that are attending here in person and everyone that's online. We are available to you and at your discretion should you need us. I hope that you enjoy the rest of your day. Thank you.